The internal watchdog at the Department of Health and Human Services has released a scathing report on the federal government's handling of family separations at the southern border. It says interagency communication failures and poor internal management decisions left the agency unprepared for the zero tolerance policy. It goes on to say that senior officials failed to act despite warnings from staff because, quote, communication about family separation was impeded by an organizational culture that discouraged putting potentially controversial information in writing. For more, let's bring in Camilo Montoya-Galvez. He is a CBS News immigration reporter and joins me now from Washington. Camilo, thanks very much for being with us. Why was HHS so unprepared for the zero tolerance policy?
Well, the main reason, Elaine, was because the department was largely kept in the dark about the implementation of a border wall crackdown to separate migrant families as a deterrence mechanism. The department, according to the report, was not given prior notice by Department of Justice officials and as well as Department of Homeland Security officials who were spearheaded efforts to implement this policy first in late 2017 and then in the spring of 2018 when the zero tolerance policy went border-wide across the southern border. And another reason too, Elaine, and this is underscored in the report, is that HHS leadership did not play an active role in shaping immigration policy, believing that the task was one for DHS and DOJ and that they would adapt to any policies that would affect them. And all those policies being policies that affect unaccompanied migrant minors who HHS cares for.
Well, when did staff who care for migrant children first start raising concerns about family separations?
Yet in late 2017 and early 2018, employees of HHS across shelters in the nation were seeing a significant uptick in referrals of unaccompanied migrant children from DHS. It's important to underscore, Elaine, that for many years, this agency was accustomed to taking care of unaccompanied migrant teenagers who obviously have the ability to cross the U.S.-Mexico border alone, but now they were getting young, even tender age children who had been separated from their families under the zero tolerance policy. And many officials and many employees, according to this report, raised concerns about the tender age of many of these children, the inadequate bed capacity that the agency had to deal with these new referrals by DHS, as well as concerns about the psychological trauma that separation inflicts on children, especially those tender age children.
Yeah, and just to clarify for people who don't know, tender age refers to kids as young as what?
2, 1. Recently born children, right? Those who still cannot speak, those who require extensive care, and attention for the entire day.
Right, right. It's just important for people to understand that what we're talking about here, as you say, in some cases, these are children who are not yet verbal, who are under this care. So the report describes a culture of not putting controversial information in writing. So what were employees instructed to do when they did raise alarms about child separation?
Yeah, according to the report, Elaine, top HHS officials instructed lower-level employees to voice all concerns about family separations verbally. In other words, to not create a paper trail of all the concerns they had about this widely condemned policy. And the report said that this effort to essentially prevent the creation of a record, a paper record of all these concerns, led to mass confusion within the agency and also prevented the department from adequately preparing for intaking all these children that DHS was sending their way.
Well, moving forward, what does the Inspector General's report recommend?
Well, the report recommends a couple of things. The first suggestion, and it's really, I think, the main one, is for HHS to play a more active role in shaping immigration policies, especially those policies that affect unaccompanied migrant minors, right? This population that HHS takes care of. Another suggestion is to bolster its mechanisms to issue directives across different shelters in the country, and also to have mechanisms in place to better store data on separated children.
Well, Customs and Border Protection released new numbers showing apprehensions increasing at the border for the first time since May. How is the administration responding?
Yeah, so apprehensions last month in February increased for the first time in comparison to the previous month, January, since May of last year. And May was obviously the height of the unprecedented surge of Central American families showing up at the southern border, most of them to claim asylum. So this breaks 8 consecutive months of lower apprehensions, Elaine. But, Customs and Border Protection Acting Commissioner Mark Morgan said today he is not overly worried about this slight uptick because he believes the restrictive asylum policies his agency and the administration overall has implemented at the border are still deterring most migrants from Central America. But he did concede that the agency is running into a little bit more trouble deterring migrants from countries like Brazil, maybe countries in Africa, Cuba, and Venezuelans, migrants that they refer to as extracontinentals because they hail from outside the North America, rather, and they cannot be placed in some of these restrictive asylum policies designed to deter Central Americans.
Meanwhile, a group of Republican senators, including Senator Lindsey Graham, are meeting with the president at the White House to discuss so-called dreamers. Those are people who are brought into the country illegally as children. What more can you tell us?
Yeah, so our White House producer, Sarah Cook, confirmed that Senator Lindsey Graham was at the White House today alongside other Republican senators to speak to President Trump about the implications of the Supreme Court's highly expected ruling on whether the administration can end the DACA program, right, which shields nearly 700,000 young undocumented immigrants who came to this country as children. The administration will have a lot of leverage over the Democratic-controlled House if the justices allow it to end DACA because Congress will be under tremendous pressure, Elaine, from advocates to move to protect this population from deportation. And Democrats might have to make some concessions on immigration, some painful concessions, I think, as well, when it comes to more restrictive asylum laws, and also maybe even proposals to slash legal immigration.
All right, we'll continue to watch it. Camilo Montoya-Galvez for us. Camilo, thank you.
Thank you, Elaine.